Hello, my name is Sarah Hosier of Sarah Hosier Limited. Today I'm going to show you how to take a blood sample using a Monovette system. So the very first thing we do before we even get to our patient is we have to wash our hands for a minimum of 30 seconds to clinical standards. Once we've done that, we're going to greet the patient, explain who we are and why we're there, and we're going to get consent. I use one sentence to do all of those things. So I'll say, "Good morning, my name is Sarah. I'm here to take some blood from you. Is that okay?"
Yes, that's fine.
Perfect. So the very next thing that I need to do, and one of the most important things that we do as a phlebotomist, is to identify our patient. We need to use 3 separate identifiers for every single patient, no matter how well we know them, how regularly they come and see us. We need to do this to stop misidentification errors. So in order to identify our patient, we will use their full name, their date of birth, and either their address if they're an outpatient clinic, or the NHS number from their wrist strap if they're in a hospital. Once we've done that, we will pop our tourniquet on and palpate for a vein. So our tourniquet goes on about 3 to 4 finger widths above where we are taking blood from, and we need it to be pulled nice and tight, so there's not really a lot of give there. Once that's on, I'm going to use 2 fingers to palpate for a vein. I'm looking for something nice and bouncy and juicy, and I'm looking to check how deep the veins are, how bouncy they are, do they spring back when I touch them? So because I want to align myself with the vein, so which direction they're going in, there we go, so that's fine. So I'm going to release the tourniquet, and then I'm going to clean the area. So we clean for a minimum of 30 seconds in a circular motion going outwards. And we do this partially to push the bacteria and the dirt on the patient's skin away from the area that we are going to be performing venipuncture, but also to give ourselves a full range of options of where we could take blood from. So most people have a choice of 2 or 3 veins in their arm that we can use, so we want to make sure that we have cleaned all of those areas. Next, I'm going to get my gloves on and get my equipment ready. So we always wear gloves as phlebotomists. This is because our gloves are our first line of defense when it comes to needle sharp injuries. It doesn't stop the needle from going into your finger. What it does is it wipes off some of that blood before it gets in there. So it reduces your risk of bloodborne pathogens. Next, I'm going to get my needle for the Monovette system, sometimes known as the s-monovette, and I'm just going to rip it open. Once I've done that, that's ready to go. So I'm going to retighten my tourniquet, and I'm going to just remove the top off my needle, and then I need to check to make sure that the bevel is facing the right direction. The bevel of our needle needs to always be facing the ceiling. This just makes it easier for our needle to travel through the skin and into the vein. So once we've done that, I'm going to anchor the vein by pulling down gently, and I'm going to pop the needle into the vein. Then I'm going to get my tube and I'm going to pop it on and twist it, and then I'm going to draw back gently on the syringe, until my tube is full. Okay, once I've done that, I'm going to twist the Monovette tube and pull it off. I'm going to get my cotton wool and release my tourniquet, and holding my cotton wool just above the site, I'm going to gently remove the needle and pop up pressure on. If you can just hold that for me, please. Then I'm going to dispose of my needle in the sharp spin, and whilst that's doing, I'm going to just snap the edge off the syringe and do a few inversions to make sure that my blood is properly mixed with any chemicals that are within the tube. Once that's done, I'm just going to check that my patient is okay. And there we go. Then I'm going to tape that down. And once this is done, I will then go on to label my tubes, thank my patient for his time and send him on his way. Thank you. Thank you for watching my video. If you'd like to learn more about the services that I offer or to see more of my videos, then please visit my website www.sarahhosier.co.uk. Thank you.